Hello, today we are going to talk about contact disorders in children and adolescents. Contact disorder is a growing psychological disorder among children and adolescents. In this presentation, we are going to talk about the basics of contact disorder, the etiology, the risk factors, how to assess, and what are the treatment approaches, and what are the expectations or the outcomes of contact disorders or any kind of disruptive behavior prevalent in older children and also the teenagers, which is characterized by defiance and aggressions, and that can also be considered as any kind of behavior that is out of norms or rules, and it is the characters that the children cannot abide by the authorities, the rules or norms. These disorders are characterized under ICD-10 as F91 and involve, as we said before, the patterns of violating societal norms and rights of others. And these children are mostly aggressive and disregard for social norms. The symptoms can also include lying, stealing, and destruction of public and private properties and violation of rules. And the risk factors or the etiology of contact disorders, as like any other psychological disorders, include genetic predisposition, environmental influences, and neurobiological differences. And the genetic influences may result in impacting impulse control and emotional regulations. And environmental factors like parenting styles, exposure to prolonged exposure to violence, and the place or the ambience where the children live in can increase the risk of developing contact disorders. Neurobiological differences in brain structure and functions are observed in individuals with with contact disorders. How to assess contact disorders? The assessment of contact disorders involves the evaluating their behavioral and emotional symptoms, family dynamics, and academic performance. Diagnosis: there are certain criteria or the standardized criteria to diagnose their behavior as contact disorders, and it also requires input from parents, teachers, and mental health professionals. And there are assessment tools like the disruptive behavior disorders rating scale and child behavior checklist are commonly used to assess symptoms and severity. But early identification and intervention are crucial in managing contact disorders, and the students who fail to get the proper intervention during their early childhood for the contact disorders may develop antisocial personality disorder in the later life. And the treatment may involve parents, mental health professionals, and teachers. Then parent training, social skills training, medications in several cases, that means the severe cases, and CBT, cognitive behavioral therapy, may help. And cognitive behavioral therapy aims to modify the negative thought patterns and behaviors, promoting positive coping strategies and problem solving skills. And parent training programs assist the parents or the caregivers in setting boundaries, implementing discipline strategies, and fostering positive parent-child relationship. Social skills like empathy, conflict resolution, and communication skills can also enhancing those skills can also help the students or the individuals, the adolescents, to overcome contact disorders. Early intervention and comprehensive treatment can improve the prognosis for individuals, but untreated contact disorders is not only harm to themselves but also it is harmful to the society or the people around them. That means they can improve or they can increase their likelihood of delinquency, substance abuse, academic dropout, or underachievements. Long term outcomes are influenced by the severity of the disorder and the presence of protective factors such as stable family support and positive peer relationship can increase the positive outcome. Thank you for your active listening, and